Hi, everyone, and welcome to Take a Pause with Menopause, where we will talk about the pause in all of her glory and not so glory. But the conversations are always going to be honest, real, and maybe a little bit funny. So I'm happy to be joined with my partners in Menopause, Debbie and Raquel. Hello, girls. Today, we are talking about the pause, but something bigger than symptoms. We're going to be talking about like the community impact and how menopause, it's not just personal, it's a workforce, it's a healthcare access and economic stability. Who knew it was all of that? I didn't. But we are happy to have our guest today, Dr. Travis Walker, who is Chief Medical Officer of Community Health Alliance in Nevada. So, welcome to Dr. Walker. And, you can let us know about, as we usually say, as I had mentioned, we ask everybody's journey, but how is Dr. Walker? How are you today? And what is your position as CMO, like just all that? So welcome and let us
Yeah,
hear
yeah,
your story, not journey per se.
yeah, yeah. Thank you so much for having me. Yeah, as I'm sure anybody can tell, my journey is very different. Yeah, but I'm a practicing family physician, and early in my career, I started practicing family medicine, but with obstetrics, and with that comes a lot of women's health. Preparing women for pregnancy, dealing with the after effects of pregnancy. But I built up a large women's health patient population over the years, and it's become an integrated part of my practice, which I think it is for most every family physician I know. But as you grow with these patients and as they come into your practice, you start running into and I think I've told you guys before, the second puberty, I call it,
Yeah.
Yes, so accurate.
the other change in life, and it's something that's it's unique to women. It's not something that any man can experience, and I've had to experience it vicariously in my practice. I've had to experience vicariously in my family with, watching my mom go through the change, having that perspective of seeing so many different presentations of menopause, seeing so many different outcomes, reactions
Hmm.
to
Mhm.
menopause. It's given me, a unique sense of this very natural human experience that is unique only to women.
Right. Yeah.
Well, that's interesting you bring it
Okay.
up about you're, like, watching your mom, and, like, how was that different from seeing it in the healthcare practice? I mean, I'm sure you experienced different things. I mean, not to put you on the spot. Answer that
Yeah, yeah.
however.
Yeah, so, I mean, obviously, my mom was my mom. I love her dearly, like I think most, kids do, but
Right.
it's different when, you practice medicine because
Yeah.
you have to translate this to another
Hmm.
language of,
Hmm.
the medicine through the emotion. I don't have that connection with my patients like I have with my mother, and so,
Right.
I may respond more personally, to, something that's going on with her where it's a lot easier when I'm not as emotionally connected to a patient.
Right.
I try to
Yeah.
connect with everybody, but it's one of those that, I'm dealing with kind of two different faces, two different perspectives. And watching her go through it, it's one of those that I'm like, okay, you need to take a step back. Sometimes you need to put on your medical hat and understand that, this is,
Yeah.
some of her reactions or the things that she's going through are not necessarily related to you. This is her. And you have to try and as best you can. I don't think I can empathize, but sympathize as much as I can.
Hmm. Hmm.
That's a lecture I need my children to hear because they don't kind of understand things that I'm going through, and they just think, "Oh, mom, you're being overreactive." So it was interesting for me to hear it from a I mean, although you're grown, you're still the child. And so, yeah, that I
Yeah.
appreciated that vulnerability, if you will.
Yeah. It's a it's a unique perspective, I think, to be a man going through this. Like, I have a knowledge and understanding.
Yeah.
I've seen not just menopause, but so many women's health related issues that
Yeah.
affect their life. And they're uniquely human, but uniquely unique to womanhood. And it's something that we also have to, take a step back that this is where biology is very different for one half of the population than the other.
Hmm.
Yeah. Yeah.
Right. And we have actually seen some things too where we have spoken before with other guests how menopause at some point sometimes should be treated as like a whole body, like a whole system treatment, as opposed to just, women's health, just like OBGYN in the sense, because there's some, for me, I had a lot of palpitations and stuff. So you go to the cardiologist or women are referred to neurologist or so. It does take on a whole body. I think it encompasses everything. They
It does.
do like
It does.
diabetic management and stuff like that, and you get, referred. But I think sometimes the referrals for menopause are tricky because you don't get to the root of what's actually causing this situation.
So actually, I was just at my OB appointment, so perfect timing for talking about this. And normally I don't talk about it with him. So I'm wondering in your practice, like do women like what age do they come in and or do they even know to ask you the question? Because my
Hmm.
doctor actually I brought all my stuff, all my hormones. I said, here, look at what I'm doing now. And he went, oh. And I go, well, I even brought my labs in for you. And he goes, well, he goes, it's that age you're at. I go, I know, but I want to. He goes, well, you never told me. Like you never came out and said what you were actually feeling.
Hmm.
If you don't tell me, how could I even know what to do for you? And I'm
Right.
like, I don't know. He said, well, all these years you've been coming in and you've had all these symptoms, but we never put them together. We were so busy dealing about regular stuff that I just thought I was having anxiety. I was having heart palpitations. I was
Hmm.
having all that, but I don't even like, I wasn't connecting it and he wasn't connecting it. So now that I had the conversation, we are having that, we are actually going to be dealing with it together, which makes me feel better to have it all with my OB that we can understand each other. But
Hmm.
are at what age are you seeing women come in like in their 40s saying what's happening or is it just a taboo still?
Yeah, I mean, so the average age of menopause onset is 51, but that's the textbook answer. I mean, it can hit early, it can hit late, and and sometimes it's a fault of medicine. Like it's unavoidable. You have hysterectomies, or if
Right.
there's an ovarian cancer, there's surgical menopause that people get put into. And I think it's easy for us because we're like, okay, if you don't have ovaries because we had to take them, then, we know you're going to go through menopause. But it's a lot more occult when it occurs naturally. And so if I have a 40-year-old woman who's going through early menopause, that can be something that's difficult to diagnose because it's like
Hmm.
this is too early. And some women, I've had patients into their late 50s, almost 60, that went into menopause at that point. And I think because it hits in such a wide time frame in someone's life, or it can
Hmm.
hit, it becomes difficult to kind of separate out. And
Hmm.
no one woman I've found presents the same way with when that change happens. And so if you're the person that hey, it's palpitations and you don't get a lot of the other things like mood
Right.
swings or
Yeah.
whatnot. You might be thinking as a physician, like maybe we're dealing with a
Yeah.
cardiac event, or we might be dealing with some sort of systemic issue, or one system that's involved in this issue, or GI issues that come up
Hmm.
with
Hmm.
changes. It's not always as simple as like, well, my periods are more irregular
Hmm.
and
Hmm.
this is going on. Some people start having those symptoms with regular periods, you
Hmm.
know, and then it can drag out for a long period of time. You may have a year of going through perimenopause before you hit menopause, or
Hmm.
2 or 3 or more years of dealing with that, and then it's trying to separate, well, is this the ongoing problem of this physiologic change that is normal versus
Hmm.
am I missing something
Hmm.
that could be much, much worse? And because it involves the whole body, because it involves so many systems, we're always trying to make sure, like, yes, this is a normal process. We want to rule out that you're not having a worse medical condition or worse medical event. But then when we get down to that point, it's trying to figure out, all right, now how do we mitigate, the symptoms? How do we make
Hmm.
this not miserable?
Yeah.
Because some people get it, do well and some people don't.
I really envy the people
Oh,
that
yeah.
do well. I'm not gonna lie.
Yeah. We call them unicorns, Dr. Walker. We actually do. We're like, well, they must be a unicorn. I
Oh,
still
must
haven't
be
found a unicorn,
nice.
but it must be nice. Yeah. But it is so true in the
Yeah.
sense of, yeah, you know, what every woman's dealing with. And like Debbie said, you don't know, it takes a back seat even for the woman because you're not even thinking about
We're not
menopause. I
even
know
thinking about it.
when the palpitations, like you said, I'm like, my gosh, this is horrible. It wasn't even thinking of menopause. And then when you go forward and find out menopause, you think back and you're like, oh, yeah, that tracks. Like everything that
That
was
probably
happening.
so many dots get connected.
That was, yeah, so
Well,
many dots.
and I make the connection to, like, I joke second puberty, but it's similar to first puberty. Like,
Oh, yeah.
when your kids and when I went through it was very different, but, like, when your kids go through it, you're like, "What is going on?"
Yeah.
And then you have to put it through that lens
Serious.
and perspective of the fact that, okay, this is out of their control, like, this
Yeah.
is their body doing what they need to do, and that change and becoming accustomed and used to that is difficult. And I think that that same, effect happens. Like it feels normal. Your body is doing what it is normally supposed to do, but it's a change that, sometimes hits like a sledgehammer. Sometimes it comes like a unicorn. I don't know, but
Correct.
it, 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 it's difficult because it is your body doing its
Hmm.
normal thing
Yeah.
Right.
and you feel like you're reacting normally, like with the exception of things that can be scary, like why is my stomach upset? Why
Yeah.
is my heart beating like this?
Yeah.
Why do I have urinary tract? Like all these different
Yeah.
All the
systems that get
things.
affected.
Yeah. Yeah. It's
Do
a
you see
doozy.
It's a doozy. What are you seeing as the greatest opportunity to improve care for women in the community? Or any community, not just ours. I mean, I think personally education and like having these conversations, but on a more granular level, coming into doctors' offices more educated, do you think that would be an improvement for women? What are some things you could recommend?
I always educate, like always try and
Hmm.
understand what's going on with yourself and recognize when there's a difference in your body, but it can be difficult to recognize. And I think
Yeah.
the biggest thing is to try and have an open conversation, and try and remove some of those stigmas that
Hmm.
we may not inherently recognize.
Yeah.
I think periods are a conversation that are very difficult to have openly,
Hmm.
and I think that is something that just culturally, like we don't talk about. I think
Yep.
women may talk about it more amongst themselves, but it's not a conversation that comes naturally, if you were to have a male physician. Or oftentimes I find, hey, it's not a conversation that comes easy when I'm talking with my wife, and I'm a physician and she's a medical
Yeah.
professional as well.
Yeah. Yeah.
Yeah.
And I think if we can take that step back and say, like, all right, how do we talk about this without having kind of that societal cultural norm really filtering into that conversation, that's muting conversations and words in ways that affect how we accurately express what's going on. And I
Hmm.
think
Yeah.
trying to understand that that is in the background is the first thing that changes the conversation when I'm talking to women.
You're right. Just like the awareness, like, okay, this is probably not their baseline. This is not where they actually want to react at. Like they're just coming from a place of like heightened cortisol or a heightened
Hmm.
hyper, awareness or something like that. I
And
could
I,
absolutely see that.
yeah. And I think too, like just in general, like women, I can speak for myself. Like it was, by the time I went to the doc, I had to really, really, really have something wrong, because I'm
Mm.
like, well, I'm not going to go, but if my children were sick, yeah, I'm calling right there. I'm calling the doctor's office, right then and there. For me, I'm like, by the time you get there, there's so much that you have to talk about. You either A, forget everything that occurred the last 6 months while you were, trying to
That
be
is so
like,
true.
I don't need to see the doctor yet, and then you're trying to be like, okay, this is what's happening, and trying to like just give you like a dissertation of 30 minutes and be like, here, now fix me. So I think there has to be like for
Well,
education for women to know like, hey, touch on the high points of what exactly is going on to help you also.
yeah, and I think it's one of I think the reaction I see in patients when I am talking about when I jump into the questions like, when was your last menstrual period?
Mm,
Was it normal? How long did it last? Was it heavier? Was it lighter? What were you going through? The reactions I see initially, it's a little reserved, it's a little guarded,
yeah.
like, "Whoa, okay, we're talking about something very intimate." And
Right.
I'm a physician. I'm here to take
Right.
care of you. I'm here to
Yeah.
talk about those things, but there's still that hesitancy that comes up when we
Mhm.
start having these conversations. Having conversations about sexual health and well-being, like, those are also difficult conversations for people to have, but those all start to kind of hopefully break down when we have those conversations, that stigma of like, "No, this is okay to talk
Mhm.
about."
Yeah.
That you should talk about it if you don't talk about it. Um, those things are information that plays a critical role in how I decide, is, for example, are these heart palpitations cardiac?
Mhm.
Or
Oh.
it's like, "Oh, by the way, yeah, no, I did have a lighter period or a heavier period, or it
Mhm.
lasted longer or didn't last as long or came in at odd time," and those conversations change the direction.
Right.
Having conversations like, "Hey, sex is different."
Mhm.
And when that change, like, when that comes into the conversation, now I'm thinking, "Okay, how does this information change how I'm, evaluating this conversation?"
Yeah, yeah, and that's a good point too, because there are things that women are very reserved about talking with, and I think it's just because of the taboo, we just have been kind of quiet about it for so long. So it's nice to be able to like have these to me it feels refreshing. I don't
Yeah.
know that every woman is going to feel that way, but to me it feels refreshing because I feel like the more I know, the better I am and the better I'm able to help myself and not just rely on going to the doctor every 5 minutes. Like maybe I get up and work out a little bit more, or maybe I don't push myself so hard sometimes. Those little tidbits are help me get through my day to day.
Yeah.
Absolutely.
Yeah, I agree. Like, at work, which, like what we were saying, how, like, with, I bring all of the people that I'm in the OR with, like if I have brain fog and I can't remember something, and I was like, hey, brain fog, you're going to help me. And they were like, oh God, here we go again, and it's so funny because I'm the one that's bringing it out in the open. So I don't feel uncomfortable. I'm making it like known that, hey, and then they all help me. And then when they can't remember, and I'm like, do you have menopause also? And they laugh and they were like, Mare, we're just here to support you, whatever you need, and it's funny, but you sort of have to include it because it is out there. So I wanted to ask, do you see, like, in your office, you get your patients, but like in your work environment, do you hear any conversation of menopause or anything like that? Or do you see like a retention decreasing or anything like that with women that are in menopause?
I think it's not a conversation, especially like in the workplace, that I feel like anybody is really having, or at least not in my experience.
Mhm.
And
Right.
if it's ongoing, if it is an ongoing issue, like, I think it's something that's fair to talk about.
Mhm.
And I think it goes back to that stigma that,
Mhm.
hey, I'm talking about something that's not necessarily,
Right.
well accepted to talk about.
Yeah.
I can't say that I can, outside of the clinical setting, like outside of the patient exam room where we have much more intimate conversations about this stuff, that I've seen people who leave the workforce because of menopause, but I can absolutely understand because I have patients who've come to me with very debilitating symptoms
Mhm.
that are like,
Yeah.
I need a letter for like reasonable accommodation.
Oh.
Interesting.
Every
Yeah.
once in a while, I'm like sweating profusely and
Yeah.
I need to be able to, like, get outside, get somewhere warm. I need
Mhm.
something in the office to either cool me down or
Mhm.
Yeah.
whatnot, and it truly is impacting their life. It is
Yeah.
impacting their work, their home environment, and while I can't say that I can speak to any individual that's coming to the top of my mind, like, "Hey, this is what they went through,"
Right.
Yeah.
I've seen patients who need work accommodations. I've seen patients who've been so debilitated by those symptoms, and they're on the very extreme end of, this
Mhm.
presentation. Like, menopause is affecting their ability to do their job.
Yeah.
And then
Yeah.
now it's coming down to like, okay, this is not necessarily a normal condition now. Like, it is a normal event, but it
Right.
is having detrimental effects. And now
Yeah.
it's time for, me to do everything I can to make sure that we navigate this change,
Mhm.
without it affecting your job, your career,
Yeah.
your family, I
Yeah.
mean, even your own personal and emotional, psychological well-being.
Yeah. Yeah. And which are
Yeah.
huge.
Mhm. Yeah.
Especially if it
Mhm.
kinda goes unmanaged or you don't understand what's happening or you can't have those conversations when you do get to your provider, then it continues to go a little unmanaged because you're not able to articulate the things that you're experiencing, kind of like to Debbie's point. She had been going in and just, they were kind of trying to root cause maybe other like specific things, not putting the dots together. So yeah, I think that is a really good point.
Yeah. I think it's
Mhm.
awesome too that the women were able to, because there's the fear of losing your job. So they had
Yeah.
the ability to be like, "Can you write me literally a doctor's note?" Which it's needed, because I can tell you, like, with the hot flashes, I knew where every cooler was, every like beer cooler that in every little convenience store. I don't even drink beer, but I would just go in there and just stand in
Oh,
there
god.
while my husband was getting gas, and I'd be like, I'd come
Ah.
out no gas, and I'd be like, no, no beer, and I'm like, no. They didn't have the brand that I liked, and they're like, okay. It's like, I just need a minute. So I understand, like, a woman being like, can I step outside? Yeah,
Right.
yeah,
Yeah,
I'm
right.
picturing myself in a few of those instances.
yeah. It, yeah.
Absolutely.
Shoot. So, how do you see community partnerships strengthening education before women ever walk into a clinic? I mean, we are so big on like community and having these conversations. We feel, the three of us personally feel it's so huge to like have that like backbone and that strength, strength in numbers, I guess, but it's more just strength in like conversations because we
Hmm.
want to help women, have these conversations and feel less taboo about it.
Yeah. I think having open conversations is the first and foremost issue, like,
Hmm.
letting people know, that it's okay to talk about these things.
Yeah.
And I also think professionally, this is one of those things that, for the timing of when this hits in a person's life, you have people who are, usually, very advanced in their career. You've maybe been in your field for, 20 years, 30 years by the time this starts to come on. You may be at a point in your family where, other, big emotional events are going on. Kids are leaving the home,
Hmm.
your kids are having families of their own,
Caring for aging
and,
parents.
Yeah.
caring for aging parents. I mean, and this is something that, I go through as a son, that will go through as a father. And I think looking at, the fact that this is one more thing that's going to happen in, a very critical time in someone's life. You're talking about, I'm going to be, if I'm 20, 30 years into my career when this hits, if I'm at the top end of that ladder, how does that affect my performance, when I've maybe become an upper echelon figure in my organization or a very seasoned professional, and now maybe I can't perform at the level I was performing before? Um, while simultaneously, midlife crises may be going on, family dynamics
Hmm.
are changing, which, adds to the emotional, piece that can be brought in by menopause. I think that those are like community partnerships and recognizing how that affects not just, biologically how women are responding to, this change, but, familially, but professionally as well. And really not just looking at, yes, the system is integrated biologically, but our lives are integrated as well. And
Yes.
you can't, it's very difficult to separate, 100% work from family. It's hard
Hmm.
to separate, your person from your work and your family as
Yeah.
well and your friends. And I think that the timing of it comes, especially just professionally and familially, it's also a sensitive, addition to those problems, or not problems, but dynamics.
Hmm.
Fair.
Yeah, yeah. I mean, I can completely agree, because I've been a nurse in the operating room, different operating rooms, not the same one, but for 38 years. And, you are up at that higher level, I'm in charge, I'm doing it. And then menopause hits, and I was like, I can't, nope, fatigue and just the whole litany of symptoms. And now I'm to the point
Mhm.
that, like, I'm not in charge anymore. Like, and I step back, and my managers, they were all like, whatever you need. And I was like, well, I don't know what I need. I just know I don't know why I can't do this anymore. And it was just crazy. Like, after, you do it, it's second nature. But then you convince yourself that no, it's not second nature. Like, I don't know. So I do know there's Angela, who is our other partner. she has a consulting for HR, and she said a lot of her clients were women that were like midlife that are changing careers, and they didn't know why they were changing careers because where they were before, they don't feel like they can do, and then, change. So it's like even we as women don't know why we can't do
No,
our job.
no, we start thinking we're unfulfilled and we start making all these
Yeah.
changes and we're still like spazzing out. But I think getting to the root of like having these kind of conversations
Yeah.
and figuring out how to strategize going into midlife is probably the better way to come across
Yes.
this.
Yes. Yes.
So I have
Yes.
a personal not really a personal question, but for the men listening,
Yes.
and they're either they're a husband, they're
A brother, a
a
son.
dad, a brother, or they're the boss, or they're the coworker, and
Yeah.
you see your partner, your employee, all of a sudden her mood's changing, or she's coming in like, oh, I don't feel good, or she's, her highs and lows are going, or she's doing like this, like I'm doing right now. What what would you say to another gentleman who's listening who said, "Oh my God, this sounds just like my partner"? How would you tell him it's okay, slow down? You see all these ads where their wife they look around the corner and they're like, throwing cookies at them,
Afraid,
like,
like,
and they're like, don't talk to me. And really, I totally remember. I mean, I remember my mom just being in her bedroom and she'd have the lights off. And I'm like, why is every month we don't see her? And like he was, oh, it's that time. And I'm like, what
Yeah.
is that time? What do you mean she's in the dark? Like, I don't know. Well, I don't want to go sit in the dark. But what would you say to a man to say, slow down? She's going to be okay. What would you say?
Tread carefully. I
Tread
would say,
Yeah.
carefully. Yeah.
Yeah.
I mean, it's Girl Scout season, so maybe having their favorite box of
Oh,
Girl
there you
Scout
go.
cookies,
I
I
like
don't know,
that.
Listen,
It is Girl
there,
Scout.
good
Yeah.
call,
no,
good
let me
call.
tell you,
Thin
there's
mints.
Dr. Walker, there's
no,
nothing wrong in a good cookie. I agree.
No, fair.
Cheetos. Yeah.
yeah,
Ice cream.
Throw some
I
ice
went
cream
through a
their
lot
way.
of ice cream, and I'm lactose intolerant, so it didn't do me any good.
I and then adds to the confounding, symptoms that are
Yeah,
going
I
on.
know.
Yeah.
Yeah, I can't speak for every man out there, but I will say that, if you recognize that, hey, this is something that's very different, like, I think, having that conversation, no assumptions, just being like, hey, I noticed, a bit of a change. And if you feel like you have that relationship with that person professionally, like you're good work friends, things like that, that you can talk candidly about, hey, like I noticed things are different. Like, you doing okay? How can I support you? I think coming in like a sledgehammer and saying, hey, are you in menopause? Or like, it's probably
Yeah.
gonna hit
They're
hit the
gonna
Gonna
wrong.
say,
throw
are you
something at
crazy?
you.
Have you
I
lost
don't
it?
recommend that is not a recommendation.
Yeah, and I'm gonna take that piece of advice, with me, so no, but I mean, if you're having, that conversation with your significant other, your wife, if you're having that talk with your mother or anybody else that, being sensitive to the fact that, this is it's an emotionally charged conversation because even if a woman recognizes that she is going through menopause, it's still, I think, a grieving process as well, like,
Yeah.
this is where I was and I'm not there anymore. And it's
Yeah.
something that's, taken away from you. And even if it's not, I mean, it's a natural, normal thing, it's a change that we have to, process and go through.
Yeah.
And I say we as in, not just women that have to process and go through that, but I know men are, with their partners are emotionally involved
Hmm.
because it affects their relationships with
Yes.
their wives, their significant others. And it's something that we may be mutually grieving. We have
100%.
to mutually navigate. It's not my, personal journey that I'm navigating, when somebody goes through that, but it doesn't mean that while she may be going through this change that I'm foreshadowing now, or at least hopefully get to this point, but that, I know that there are gonna be parts of our relationship that change
Hmm.
because her body's changing,
Yeah.
Mhm.
Women go through, a hormonal change that affects their whole body like a cliff. The hormones drop, and men don't.
Yeah.
Men have a much more indolent and slow change, and
Hmm.
and we know that men go through andropause, but
Uh-huh.
it's a much slower change for men than it is
Yes.
for women. But recognizing as a partner, either at work, as a friend, as a family member, as a spouse, as a child,
Yeah.
that, this is something that, they're having to deal with physiologically, emotionally, but also psychologically, like, hey, this is this is not my body anymore, or at least not the body that I've been
Yeah.
accustomed to for so many years. I have to try and figure out how to get used to this new one.
Hmm.
Yeah. So
Yeah.
I'm going to switch you back to the role of a CMO. You just shared us a role as a partner, a dad, an amazing man. But
Yeah.
what role do CMOs and healthcare executives and HR play? What do you think in the next 5 years can we make a huge difference?
Yeah, I mean, I'm a firm believer. So as a CMO, as a leader, like I think the big thing is to recognize that, this is another aspect of a human being. Like this is
Hmm.
Yeah.
another part of a person's lived experience. And, for some people, I think we don't treat it any differently than we would anything else. If somebody were to come to HR and say, I need time off work to go to my doctor's appointment for diabetes, and they may not
Hmm.
even feel like empowered to talk about their diabetes to HR, but to say, I need to be able to take time to go talk to my doctor. I need to be able to take time for this medical event that I'm going through if I truly am at that point where it's affecting my ability to work. Having that open conversation, not trying to hide the fact that you're going through a very normal process in your life, and maintaining those personal and professional relationships like you would in any other setting, being supportive, trying to help people get to a point where they're able to navigate that well and supporting that they do. If there is a change, like, think I'm not an HR person, but thinking from an HR hat that I can put on, you know, if I see the change in someone's work, if I see the change in someone's interactions,
Hmm.
I want to support them in a way that, allows them to be successful. I want to support them in a way that gets them the help that they may need. And doing that through the tools and the roles that we can. If that means, hey, take the time to go to a doctor, but helping somebody recognize, like, I need you to maybe.
Kel,
Yeah,
are you
Debbie
frozen?
actually said to Raquel, "Are you frozen too?" Because she was just standing there. She's like, "No, I was just waiting." We can
Well,
edit
we
this
can.
out. Don't
Yeah,
worry.
we'll
Yeah,
clip it
we'll
out.
edit this out.
Okay, so
Yeah.
we
I
can
have
just.
no idea what the last thing you guys heard was.
But you were saying about how just you didn't understand as a HR professional, but how you as a CMO, like if you saw somebody
Yes.
that was struggling, how you would want to make them be the
Heard.
best that they could be.
Yeah.
Yeah, and I think in an ideal world, that's where you would be with anybody going through anything. That
Hmm.
if you're going through unrelated medical conditions, personal issues, things like that, that somebody would be supportive at where you work to help connect you in a way that's appropriate for the relationship that you have with them.
Yeah.
And an organization I feel like should support each other through that, because if you have been in your career, if you've been working for 20, 30 years, you're highly successful, you're knowledgeable, experienced, you're a veteran in your field, it
Hmm.
would be a shame to lose somebody because we couldn't help them navigate through that. And I think that is the role of everybody as a human being, is let's support each other,
Yeah.
let's figure out a way to work through this together,
Yeah.
whether it's because you're an employee, a coworker, my boss, if you're, my spouse, my kid, my mom, like, in any setting, like, I think that's ultimately where it comes down to, and not being afraid to have that conversation, and people feeling empowered to have that conversation freely.
I think it's also best for the business also because this is a retention driver. You can keep senior level people that are, like you said, veterans in their field and they're able to, train and teach the newer people coming through. So this is a huge gap that I think is out there right now for like just any corporation, not understanding some of these things that women are not understanding maybe themselves sometimes. So yeah, this is a great conversation.
Yeah.
Yeah. I
I
mean,
would
and
agree.
and this is, again, something I would think that anybody would do for anybody, but, like, women who have gone through this, to share this with women who will go through
Hmm.
with this,
Yeah.
Yes.
and be like, "Listen, life is gonna come, and this is a part of life that you need to anticipate."
Yes.
Yeah. I think that is why, yes, I bring it up, and I know that we have all, like, I talk about it all the time, and people are like, "Oh boy, here she goes again." And I was like,
My
just
husband in particular, he's
trying.
like, "If you say menopause one more time," I'm like, "What?" It's true.
But I think that's it's so informative, Joe, just to understand, because it's not a phase that we're going through, and I
Right.
think that sometimes, it's just a phase,
Yeah.
it's not the phase that you're going through. It's a lifestyle change, but if you
Physiological change.
physiological, it's numerous, but I think just take just the
And
Yeah.
I'm doing it. I'm saying change. I'm not saying menopause. I'm saying this
It
today.
is. It's
Yeah.
totally a change.
It is a change. It is a change, but we grew
Yeah.
up with the word, "You're going through the change."
Yeah.
Yeah.
And
No.
so you felt like, "Is this it? Like, what's gonna
What's the change? What's
happen?
the change?
Where's the
Yeah.
change?" But I also was thinking about the first word that we said, journey, earlier. It's funny that
Mm,
that came up because listening to the conversation is clear that menopause isn't just a personal journey. It's a community and workforce issue, which I don't
Mhm.
think we think about that. So when women are supported by families, they're stronger. But for businesses, you'll retain the leadership and our local community economy will benefit. So I really feel like I want Reno, I want Northern Nevada to be the first city community to say, hey, we hear you, women, and we want to make a difference. So, I'm hoping that you're going to be on our side and you're going to be one of those doctors out there saying, let's have a chat. Let's not be silent, ladies. It's
Yeah.
really important.
Don't be afraid to talk to me. Don't be afraid
yeah.
to talk to any other physician, medical professional, but don't be afraid to have that conversation with, your neighbor,
Yeah.
your friends, your
Yeah.
kids, your parents. Like we should discuss this like it is a normal thing that happens in life because it is.
Yeah.
Yeah.
Right. Right.
And it's not going away.
No,
No.
no. And it does feel a little awkward and uncomfortable at first. I'll be the first to admit it. Like saying those things initially where like, you kind of dip your toe in the water. You're like, oh, I'm
Yeah.
menopause. I remember
Yeah.
the first time I said it, my husband's like, what? You're not in menopause. What are you talking about?
I
I'm
say,
like,
I am.
yeah,
But
I
we
am.
didn't know, but
Yeah.
we didn't
Yeah.
know. And
Yeah.
that's why these conversations are super important. And
Yeah, yeah. Just
Dr. Walker,
baby steps.
honestly, it's so refreshing to see well, you are young compared to me, a young doctor out there who's willing to talk about this, which is so
Yeah.
important, and willing to learn and willing to teach and to share. So we really feel like it's a blessing that we got connected with you
Yes.
because we really are hoping that you're going to help lead the way in Northern Nevada, just FYI.
Yeah.
That's going to be
Debbie.
your new
Yeah.
hat.
That's
Yeah. Well, no, I'm glad that we got to connect. We've had some wonderful conversations, this one included.
Yes, it was perfect. And I agree with Debbie. I thank you so much for just your time and your insight on
Yeah.
this. And yeah, as a physician, as a
A
man,
husband, as a
as a
friend.
husband, as a son, like
Yeah.
it's just very refreshing. So I thank you again.
Thank you, Dr.
Absolutely.
Walker.
Yes.
Thank you both so
And
much.
yeah, and thank you, girls. And like I always like to say, you can follow us on Spotify, YouTube, and Apple Podcast. And we will, what do we say, girls? See
See
you
you
Next
next
next Tuesday.
Tuesday.
Tuesday.